I think there's some need for changes. The Affordable Care Act is a top-down driven, that is the federal government telling us how much and what you should be getting for care. And some people would rather have a catastrophic policy where they're young, they're not very sick, so if there's something like a car accident or they fall off of a bicycle or something like that, they would be covered, but other areas they wouldn't want. So I think one size doesn't fit all. I think variety would be a good thing. I think having a market-driven plan is another one. I will tell you that you keep hearing from people about buying across borders. I don't know if that's familiar to you, but one of the problems with the concept of buying across border, it's not like car insurance. And the reason I say that is these insurance companies negotiate contracts with hospitals for specific pricing. So they may negotiate a price in New Hampshire, but if they go to New York to get the service and want to use that, they don't have a negotiated price with them. So that's the problem with the cross-border pricing. But I think that the solution really on the Affordable Care Act is to have it a market-driven, bottom-up instead of a top-down. But we need to get people in a room that know a little bit about insurance, and I'd certainly want to be part of that. Shut the door, lock them in, and say, come up with a new plan. And I do know the House Republicans have a new plan similar to that, but they don't know exactly how much it's going to cost.
It's no surprise to me that the Affordable Care Act has ended up being more expensive than they originally said it was going to be and less effective. We've broken our healthcare system, and it's time for us to put the genie back in the bottle, and we need to start allowing some of the market forces to drive down the cost of healthcare. The first thing we need to do is give people the flexibility to be able to cross state lines to get their insurance. It's a simple, low-hanging fruit that we have to do now. That will certainly work to drive down the cost of healthcare more than anything we can do right now.